what I have learned in my life is that life is circuitous. We
Mhm.
wish it was linear, but man, oh man, are there twists and turns. You're going to get off course. You're going to fall down. You're going to get back up. It is not easy. So you
Mhm.
got to remember that there are bumps, twists, turns, and you got to ride it.
I'm Rachel, and you're listening to the Owning Your Sexual Self podcast. All right. Hello, everyone. Welcome back for another episode of Owning Your Sexual Self. And well, look at that. We're talking about how to own your fertility today with our guest today, Dr. Jaime Knopman. Thank you so much for coming on to the show today.
Great minds think alike when we were naming our
Right.
babies, right? Yeah. Thank
Exactly.
you. Thanks for having me.
Exactly. Yeah. Again, thank you so much for reaching out to come onto the show today. I'm excited to hear more about what you offer people in the fertility world, as well as your book coming out. We're going to talk a little bit more about that. Yeah, I'd love to just hear just a little bit about your journey. What got you into this space?
Sure, sure. It's not a very creative story, but I knew I wanted to be a doctor since I was in the second grade. I read a story about Elizabeth Blackwell, the first female physician, and I was like, I want to be a doctor. I was pretty linear, as I think many physicians are, and I was like, I'm going to go to here, I'm going to go to med school, I'm going to go there. I got to medical school. I thought I wanted to do breast surgery, like surgical oncology, because I had spent some time at Sloan Kettering. And then I realized that I didn't want to do that. I really just wanted to do women's health, which is why OBGYN was sort of a perfect fit for me. And once I got into OBGYN, I was very fascinated by hormones and how that whole sort of system worked, and found myself as a infertility fellow. I was pretty lucky. My fellowship sort of coincided with the time that the ASRM was removing the experimental label from egg freezing.
Mhm.
So I was really there for a lot of the groundbreaking egg freezing studies. And here I am today.
Yeah. Yeah. I mean, makes sense. Like you just followed the passion, followed like, well, this sounds interesting. This sounds like I could be a benefit to these people. And then what inspired you to write the book, Own Your Fertility?
Yeah, that's a good question. I I said I wanted to be a doctor, but I always was like, maybe I'll be a writer, maybe somewhere I really liked writing. I noticed that, and it was really around the time of COVID, around the time of pandemic, I saw a major shift in my practice. I saw a lot more women coming in to freeze their eggs or preserve their fertility as opposed to treat their infertility. And I was really struck by it. And I thought, wow, I am seeing something and I really need to share this, but I'm only as loud as the four walls of my office. Although I am actually much louder than that because I talk very loudly. And I thought, wow, I should marry this passion with love of writing. And that's how the book came out.
Wonderful. Wonderful. Yeah, I truly feel like we need more books out there. I'm a book nerd myself, but love having stuff, especially that is women's health focused. I still to
Mhm.
this day like feel it's still we're just getting started in women's health and understanding women's health. And so, yeah, thank you. I'm excited. When does the book come out? Next year, is that correct?
January 13th, 2026. I can't believe
Woo-hoo.
it's so close. I mean, I can't believe it's almost Thanksgiving. It's like the
Yes.
older you get, the shorter times feels, I guess.
Yeah, well, congratulations again. That's a huge accomplishment, and we'll make sure to link this in the show notes. I know we'll talk a little bit more about it on the show today, but definitely
Thank you.
want to help, yeah, listeners get a copy of that. Um, so yeah, let's get into the, fertility literacy and what we're feeling like every woman should know. If someone only learned three things, let's say about fertility today, what would you want those things to be?
Yeah, I think the most important is that it's not a given, right? Unfortunately, it's not a given. I think most of us, especially like I could, the women in the audience, listeners, we sort of just, we're little, we play house. I see my girls do it. They put like pillows in their stomach and they're like, I'm pregnant. And so we just assume we're going to be parents. And unfortunately, that doesn't always happen so easily. So I think we have to stop assuming that our fertility is a given. I think we need to know that we are born with all the eggs we're ever going to have, and we never make new eggs. So it's really a short window for when those eggs are going to function and be usable, and
Hmm.
then that it's sort of hard to get pregnant. And trust me, I have now teenage daughters, so I don't want them thinking, oh yeah, whatever, just have some, protected intercourse, because the reality is that's not true. But when you try to get pregnant, I think a lot of us are struck with how challenging it can be to conceive.
Hmm. Hmm. So how early do you think that women should start thinking about their fertility health, even if they don't plan to have kids?
I think we need to teach it in, like, we need to teach it in health class. We need to teach it in sex ed, right? We talk a
Mhm.
lot about avoiding pregnancy. We should also talk about how to get pregnant. Now, I'm not suggesting that, teenagers need to come in and talk about getting pregnant, but I am suggesting that teenagers should know about their body. I run a summer course for high school students, and they should not tell me that when they get their period, they think it's their egg coming out, right? Like, we should have some basic fertility knowledge.
Hmm. Hmm. Yeah, and that leads me into like what are some of like the biggest myths or misunderstandings that you're hearing these days?
Well, I think the biggest myth is that the pill caused my infertility. The
Mhm.
pill has gotten a bad rap, man. It's sort of like, I'm a mom, so I feel for all the moms. It's sort of like your mom with your kid, right? Your kids blame you for everything. So the pill is the same way. Everyone's like, oh, who's the pill? The pill doesn't cause infertility. It can mask infertility. So if I'm struggling with infertility, I may not know that that might come down the pike if I'm on the pill,
Mhm.
but it doesn't cause it. So I think that's probably the biggest thing.
Yeah.
I think a big myth is that if I'm getting my period, I'm definitely fertile, right? Like, people, unfortunately, you can get a period until you're 50, but it doesn't mean your eggs are going to make a healthy pregnancy.
Mhm. Mhm.
And then I think another big myth is that it's always the woman's fault, quote unquote, right? It takes two to tango. And a lot of fertility struggles are attributed to sperm. And so your partner does need to be evaluated just like you need to be evaluated.
Mhm. Yeah. Yeah, I think a few months ago we had another guest on the show, and forgive me, I cannot think of their name, but we talked about male versus female infertility and the kind of all the ins and outs in each of those categories, which was, yeah, very, very eye-opening. I think and I think also with the blaming of the pill. I'm wondering kind of my side of the work, right? Being sex therapy and sex coaching, it's like it feels like we need something to blame. Like we, as you said, growing up, we just have this assumption of like we just expect that it's going to work well, and we do so much, I think, in our younger lives to prevent pregnancy that then it comes time to, okay, now I want to do this, and then no, now I'm finding out that I can't. It's not as easy as maybe I thought. And so yes, it makes sense. It's like it's the pill, it's this, it's the shot I got, it's this, right? Like I think it, yeah, maybe it makes it easier on people to process it that way.
I think anything, it's easier to have someone to blame, right? It's sometimes like in the world too, why you're like, why do people have so much hate? And you're like, well, it's easier to hate than to actually like look inside and see.
Mhm.
So that's the same thing. I mean, a lot of you probably see this too. Like, people will come in and say, oh, I'm not pregnant because of my timing. I'm like, what do you mean? They're like, I didn't have sex on the day I ovulated. I'm like, you're fine. If you had intercourse, a couple of days before, you're still covered. Like,
Mhm.
I think we sort of want to just look for an easy fix, an easy solution, and that's not always the right way to do it.
Mm-hmm, mm-hmm. Yeah, this is something that I get controversial opinions on around ovulation. Is there only one day a month that a person can get pregnant?
No. So what the egg is ovulated and then it lives for 12 to 24 hours. So there must be sperm around that egg for that one day. So technically, yes, there is one day that it may arise. But sperm is very hardy, right? Sperm is going to live. So if you ovulated on a Thursday, but you had sex on a Monday, you should be covered, right? It doesn't mean because you didn't have sex on that Thursday that you're long gone out of the window.
Mm-hmm, mm-hmm. Okay. Yeah, helpful. So, yeah, someone that is wanting to become pregnant, knowing their fertility window, that let's say like 3 to 5 day span based on what their body is doing, ideally they would want I mean, more the better, I'm assuming, like more chances if you're trying to get pregnant. But knowing that it's not, I hear a lot of people getting caught up of like trying to nail down the exact one day to have it and getting some frustration around that.
Correct. Because there's this, like, people will like pull out their phones and they're like typing it like a note. I'm like, no, 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 no need to type this like a note. Like,
Mhm.
just process this. There is not 1 minute, right? And I also think, I mean, we're talking about sexual health, so it's like it removes any enjoyment or pleasure from the process. It becomes a science experiment long before it needed to. So if I see a young couple who's going to try and get pregnant, I'm like, great, go have unprotected intercourse a couple times a week, right? Like it doesn't need to be on one day that needs to be done. And that just, I think it should be liberating to know that.
Yes, absolutely. Because I hear, yeah, it causes a lot of behind the performance and showing up and having to get it right. And I think yeah, it almost seems like it's trying to procreate under a very stressful environment versus a very loving, like connective environment. Um,
And listen, you may not wind up, drinking too much wine, dancing and having a baby, right? Like it may be in a doctor's office, but
yeah.
it doesn't always have to start that way. Like you could just be, all right, we're just going to see what happens.
Yeah. Yeah. How can women become more proactive rather than reactive when it comes to reproductive decisions?
Great question. I feel like I'm trying to always push this. So proactive means I tell people get things tested before you try, right?
Mm-hmm.
So if when we used to try and get pregnant in our 20s, there may not have been the need to say, are my tubes open? Does my uterus look good? Is my sperm good? Because you were in your 20s, so there was a cushion. But if you're not going to start to try and get pregnant until you're 38, you don't have as much of a cushion. So being proactive and being like, I just want to make sure both of my fallopian tubes are open. That's a good idea.
Mm-hmm. Mm-hmm. Yeah, absolutely. And I know you talk in your book around AMH testing. So do you recommend like certain hormone testing things for people to go through as part of this proactiveness?
Yeah, I think it's a good idea to get your AMH checked. Again,
Mhm.
I'll say it till I'm blue in the face. AMH does not equal infertility. So if your AMH is low, it does not mean you have bad eggs or you're never going to have a baby. But if your AMH is lower than it should be for your age, it's concerning that you may have an earlier loss of egg health.
Mhm.
And therefore, if you have the ability to do something, right, whether it be egg freezing, embryo freezing, etc., you might as well do that.
Mhm. Yeah. Thank you. Yeah, and I'd love to get you've mentioned egg freezing now a couple times, and that's definitely on my my docket here. Getting a little bit inside the book if we can. So let's start with egg freezing. Who should consider this? When is this an ideal time? What are some things maybe women wish that they knew
I mean, I'm like a
beforehand?
broken record. Like, I think everyone should do it. They should do it in their 20s. And again, I'm going to get a lot of heat for it. I own it, right? Not everyone has access to it. It's expensive. Not everyone needs it. A lot of people get pregnant on their own. All true statements, right?
Mhm.
But if you lived in a flood zone, would you not get flood insurance? You would, because you're like, if I get a flood, I want to be protected. And yeah, maybe my flood insurance won't pay up, but I'm not going to live here without it. If
Mhm.
you're not going to have kids until you're in your 30s, right? And egg freezing is something you can do, why would you not do it? You may
Mhm.
never use those eggs, and those eggs may not work if you go to use them, but you want to be prepared,
Mhm. Mhm. Yeah.
right? So I appreciate that it's not as easy. I make this comparison in the book. I wanted the book to be called Wear Sunscreen and Freeze Your Eggs, but the publisher, we didn't go there. But I get it. Wearing sunscreen is easy. You slap it on, it costs $5 from CVS, and you move on with your life. So I'm not minimizing the process or the cost. But what I am saying is we need to practice preventative medicine more than reactive medicine.
Mhm.
So rather than doing treatment when we're already infertile, why don't we protect our ovaries when we're fertile?
Mhm. And so so egg freezing, somebody may freeze their eggs and then not necessarily need to use them if they are able to get pregnant on their
Yeah, a lot of women are like, oh, I got pregnant on my own, and then I got pregnant on my own again. And I never used my eggs. And I'm like,
own.
oh, okay. So you had them and you didn't use them. Sure. Then you could say, well, I spent all that money. I did those shots. Correct. But you're never going to regret doing it. You aren't. You really aren't.
Mhm.
Because you'll know that you'll feel more protected moving down the road.
Mhm. Mhm. Yeah, that makes sense. And so then let's somebody that that needs to use the eggs that they froze, or they are choosing to use the eggs that they froze, then their options are kind of moving to the next segment of the book, the IVF or IUI.
So if I have eggs and I'm going to use them, I'm going to thaw those eggs and fertilize with the sperm source, either my partner's sperm or a donor sperm. Then I'm going to grow those embryos in the laboratory, and the embryos that make it to the advanced stage Those embryos will undergo a biopsy procedure to make sure they have the correct number of chromosomes.
Mm-hmm.
And then those embryos will ultimately be transferred back into my uterus. So
Mm-hmm.
that's how I would use my eggs. I could elect to do IUI if I don't want or need to use my eggs, but your IUI is a separate procedure. So IUI, intrauterine insemination, fertilization happens in the body. In vitro fertilization, fertilization happens in the lab.
What a great like just description of those.
Oh,
Because
thank you. Thank
very,
you.
yeah, very easy to remember. And so how does a person know which path is right for them?
That's a good question. And that's one that you make that decision with your practitioner, right? Like we
Mhm.
weigh all different things. Like, did you come see me at 36 and you want 4 kids? I'm going to probably say don't do IUI because it's not efficient enough for you to have success. Or are you coming in at 32 and you want 1 kid? I'm going to say, well, maybe you don't need to thaw your eggs. So it's not as black and white. And I like to say, like, this is the art of medicine. I remember when I was in med school, we had this class called the art and science of medicine, and it always stuck with me. Like, the science of medicine is what happens in the laboratory or what happens in, like, the medications. The art is how we manipulate that to best treat the patient.
Mm-hmm. Mm-hmm. What are some of the things that impact success rates of these things?
Number one, age, right? And you're probably sick of anyone saying this to you, but
Mm-hmm.
age, and age, because the older you are, the less likely any of these treatments will be successful. And then underlying other pathologies within the pelvis, like things like fibroids or endometriosis, like other things there are going to decrease the chance of success.
Mm-hmm. Yeah. And then maybe that can move us into then the third leg here of surrogacy. When does that become a part of the conversation for people?
Yeah, so surrogacy has become more and more popular in this country over the past 5 to 10 years. Clearly, surrogacy is needed for somebody who doesn't have a uterus or a couple where there is no uterus. So if it is a single man or a same-sex male couple, they need a surrogate, right? That's
Mhm.
pretty obvious. If it is a woman who does not have a uterus for whatever reason, either a surgical removal or some nature, she needs a surrogate. Or if there's a medical contraindication to carrying a pregnancy, we
Mhm.
need a surrogate. Surrogates also are frequently used in cases where there is a uterus, but the uterus has sustained damage and therefore it is unable to carry a pregnancy. That's a
Mhm.
reason. Or in cases where there is a uterus that appears super healthy, the patient has long-standing infertility. We do multiple rounds of IVF with embryo transfer, and none of those embryos stick. Then we're going to move on to a surrogate.
Mhm. Yeah. What about for a person that has a healthy uterus, all things are a go, and they just don't want to actually carry the baby themselves? Is
Yeah,
surrogacy
I
an
mean,
option?
you can make that decision. It happens much less frequently than I think people think. I unfortunately think sometimes surrogacy gets a bad rap, or people are like, oh, that person just doesn't want to carry a pregnancy. It doesn't happen frequently. It's really few and far between where we say, oh, the person just doesn't want to carry.
Mm. Yeah, so you're seeing it, then it is more medical related for people that are
Much
using
more medical. Yep.
it. Wonderful. And yeah, anything else that you would add for how people can make an empowered decision around their carriers that they're choosing?
So carriers, the screening for a carrier is pretty rigorous, right? Because we don't want to select somebody to carry a pregnancy unless we think that they are in, like, the healthiest version of a pregnant person.
Hmm.
So there are agencies that will identify carriers, and then your physician will either approve or not approve that individual to be a carrier.
Mm, okay. Gosh, so informative. Thank you so much for all of this. This is wonderful. Um, and then, okay, so then last, like supporting yourself emotionally throughout all of this. I'm assuming there's a lot of stress, shame, self-blame, pressure that can come up with people. How do they stay grounded and connected to
Yeah.
their partner
I
throughout
mean,
this?
I think this is the hardest part, honestly. And if I had an answer, I probably wouldn't, I don't know what I would be doing. Maybe I'd be living on an island somewhere. I think it's super hard because this process beats the crap out of you, right?
Mm,
It's something we think is a given, then you're infertile, and nothing you do, you cannot control this. You cannot will a pregnancy, you cannot do any of it. So it's really hard. I say, like, having a support system is great. Like, I
mhm,
think for a lot of times, a lot of years, people were very quiet with their infertility. It was like they're shrouded in secrecy.
mhm,
And that was not a good thing because it's very, very hard to go through the most challenging moments in your life
Mhm.
alone, right?
Mhm.
So I would say share because that will help you. I would also say find activities that bring you peace, right? Like
Mm.
for me, I'm a runner. So I find being out there, cold, hot, whatever it is, like listening to a podcast, a book, some good music, that's my space. So, like, find activities that make you feel calm and try and do them because I think that will help you get through the process and treat
Mhm.
yourself with kindness. People like shit all, excuse me, I don't know if I'm supposed to curse on
You're
this,
allowed
but
to swear here.
thank you. All over themselves. Like, I'm this, I'm that. I'm like, why do you just see the bad of yourself? Like, look at the
Mm.
good. Like, oh, I did egg freezing. I only got 5 eggs. Yeah, but you did egg freezing. Like, a lot of people don't do that. So you gave yourself
Mhm.
shots, you came here, you did all that. Like, reward yourself, right? We
Mhm.
can't listen. I'm not saying I'm good at this, but like seeing the negative only is only going to make you more negative.
Mhm. Mhm. Yeah, living. Yeah, misery loves company, right?
Oh, it does. Yep.
Yeah. Any emotional patterns that you frequently see between the couples and what maybe a spouse, so if there's a significant other that's listening to the show that their partner is experiencing infertility, like how they could show up better for them?
I mean, I think no matter what it is that we do, I think just being present, right?
Mhm.
I think we forget how much being present is really what most people need. I had breast cancer many years ago, but I remember thinking like people don't always know what to say. And the
Mhm.
reality is, there's really not that much to say. You say, I'm sorry, but like, you're like, it's okay, like, whatever. But just sitting with the person so you're not like alone, like, that's a really nice thing to do. So if you know someone who's struggling with infertility, just like send them a text, be like, I know this day sucks. I'm here for you. Hang in
Mhm.
there. That
Mhm.
goes a long way.
Yeah. Yeah. Thank you so much for sharing that.
Yeah.
I would love to go into now medical access, equity, advocacy, all of that. And so there's an organization known as Chick Mission. First time I'm
Mhm.
hearing of this. Can you tell us more about what that is?
Sure. So Chick Mission was started by a woman named Amanda Rice, who is a badass 3-time cancer survivor. And when Amanda was diagnosed, she was shocked that her insurance company said to her, hey, you have fertility benefits, but you can't use them because you're not infertile yet. But she said,
Mhm.
but I just was diagnosed with cancer and they're telling me that my chemotherapy is going to make me infertile. And the insurance company was like, yeah, but you're not infertile yet, so you can't use them. So she was like beyond annoyed, rightfully so. And she decided to start an organization called Chick Mission, which provides grants to women who are diagnosed with cancer so that they can freeze their eggs ahead of chemotherapy or gonadotoxic treatment.
Wow, amazing. So, yeah, just making fertility more accessible for cancer patients then.
Exactly, because if you are diagnosed, you need to usually pretty much freeze your eggs very quickly. So you may not have the time to gather all of the resources. And if your
Mhm.
insurance company is not going to provide you coverage, then you need to find a way to pay for it.
Yeah. Yeah. And what are some things that patients you feel must ask their doctors, but maybe they don't even know to ask?
That's a good question. I mean, I don't even know what the one thing is. I think people oftentimes like they don't even know what they don't know, right? So you're sort of asking. I think a lot of the doctor patient relationship is who you feel comfortable with. I think you have to feel like you've established a rapport and you feel comfortable
Hmm.
because that is really the best way to start and initiate a relationship.
Hmm. Yeah. Yeah, I have that conversation time and time again with people, inside fertility and outside, but I think your relationship with your doctor, I agree 100% is so important. If you feel you're getting dismissed or your concerns are getting minimized, or not getting the answers that you want, I think that, right, this is a person, a medical professional, you're probably going to be spending a good amount of time with going through this. And so that comfort, yeah, I'm wondering if that
And
even makes
not
a
every
difference.
relationship works. Like I'm always like, yep, that me and that patient are just not right for each other,
Hmm.
right? So
Hmm.
there are patients that I'm like, you probably should get a second opinion because this may not be what you want. Like I am very honest and very blunt. That's just who I am.
Hmm.
I get that that's not for everyone. When I was like a younger physician, I used to get so upset. Like when patients would leave, I'd be like, oh my God, what did I do wrong? Et cetera, et cetera. Then I like realized I was like, it's not necessarily me doing something wrong. It's just that maybe my personality isn't good for that person. It's like why people, you can like not every relationship turns into a marriage, right? Like
Mm-hmm.
people are sometimes right for each other, sometimes they aren't.
Mm-hmm. Mm-hmm. Yeah. All right, let's get into some real life guidance.
Okay.
So, if someone is listening to this and they're wanting to be more proactive, they're not sure where to start, what is one step rather, that they can take this week to get started on this?
Read our book.
Obviously, yeah.
I'm
Read,
serious.
yeah, yeah.
Yeah.
Read books. Yeah, I often respond with that the same way. Read books,
Yeah.
listen to the podcast, find the blogs that are talking about this. Absolutely. Uh, and then women in their 20s, 30s, 40s, anything that they should specifically be thinking about now without bringing in any sort of panic for themselves.
Yeah, I mean, I think those are all very different age groups in the world
Mhm.
of fertility, right? So I think in our 20s, consider egg freezing if you can. Talk about it, talk to your female relatives, learn about their fertility struggles or, how it was for them. In our 30s, you got to really get down. It's like, it's sort of like I think about like when you take a test, right? Like the night before you're cramming, the cramming period, that's your 40s, right?
Mhm. Mhm.
The when you're studying 2 nights before, that's your 30s, but it's probably a better idea to start studying a week before so you're not stressed. So like doing it earlier gives you have more leeway, you have more
Mhm.
runway to plan.
Mhm. Yeah, absolutely. Well, thank you so much for this conversation today. I feel that yeah, really gave some good, very clear, precise answers to people. Anything that we didn't discuss that you wanted to include in this episode or you want to make sure that listeners know?
I think got most of it. You and I were very like very succinct. We were on it. We were like, we
Hello.
know we're going to
Hello,
talk
type
about.
A.
We're gonna exactly. I'm like, linear. Just keep going, keep going. But actually, it's funny. I say that, and then you'll see the cover of the book is circular. It's not linear because I say what I have learned in my life is that life is circuitous. We
Mhm.
wish it was linear, but man, oh man, are there twists and turns. You're gonna get off course. You're gonna fall down. You're gonna get back up. It is not easy. So you
Mhm.
got to remember that there are bumps, twists, turns, and you can't. You got to ride. You got to ride it.
Mm. Yeah, definitely. Yeah, in my line of work, it's generally like healing is not linear, but same. I think yeah,
It
that
is
can
not.
really
Yeah.
apply through all parts of life.
Like
We
the
might have a
grieving
plan.
process, I think a lot
Yeah.
about the grieving process. I write about it in the book. I'm fascinated by grief because I used to think I'm like, okay, you will grieve, you will be anger, then you will have this, and you have this, and you have this. And I
Mhm.
was like, oh, wait a second, actually, it's not. You can go from anger back to bereavement from like it's
Mhm.
fluid.
Mhm.
And it's very fascinating how you when you look back on a time in your life when you were grieving, you're like, wow, yes, that is true. And we have to
Mhm.
recognize that.
Yeah, absolutely. Well, yeah, it sounds like this book is got a lot of information in it. There's many things that people can learn and take from this. Where can listeners find, like, get in contact with you, work with you, or do we have pre-order
Sure.
information for the book?
So I have an Instagram page. It's just Dr. Jaime Knopman, Jaime. I could kill my parents for spelling my name like that because there are probably so many lost emails for me. So that's our Instagram. We now have a website. Again, Dr. Jaime Knopman, pretty easy. And I work at a place called CCRM, the Colorado Center for Reproductive Medicine. I am located in New York, but there are clinics around the country. And yeah.
Amazing. And as we wrap here, just a final message from you for listeners. What do you want women to remember about their bodies and their choices with this?
Oh, that you control your body. Your body
Mhm.
shouldn't control you. So you can make the decisions and it's nobody can tell you what to do with your body. No, it's yours.
Mic drop. We're ending with that.
As
Thank
my girls would be like, "Mom, you slayed." I'm like, "Oh,
Oh,
thanks, guys."
Slay, yeah.
But yeah.
Thank you so much again, Jamie, for coming onto the show today. It was really an honor to have you as a guest.
You're so welcome. Thank you for having me. Happy Thanksgiving.
Yes, happy Thanksgiving. Thank you so much for listening to today's show. If you loved it, be sure to subscribe so that you never miss an episode. And if you really fucking loved it, make sure to tag me on social media at the Rachel Main. I'll see you next week.